My name is my name is Cassie Englund. I'm a physical therapist here at Fairbanks Memorial Outpatient Rehab, like Barbara said. A little bit of my background. I've been working for almost 10 years now in PT, mostly in neurologic rehab, which means I've worked with patients all across the spectrum on balance and mobility. And that's kind of my favorite thing to do. And then I also have my coworker here, Katie, today, like she said, who will help answer some of the questions if you have questions along the way in that chat box. And then we'll kind of have open questions for discussion here at the end as well. So I'm going to go ahead and share my screen here for the presentation. All right, so my hope today at the end of this kind of discussion is really that you would be encouraged that your balance can get better. And there are things that we can do to prevent falls along the way. So first, a couple facts about why preventing falls is so important. So these facts are all from the CDC's fall prevention website, which has some wonderful resources and handouts on balance and fall prevention. And they also have a sister site called Steady, where I found some more great resources and information. Some of these facts from that website were pretty pertinent to me and kind of stood out. So falling once doubles your chance of falling again. 1 out of 5 falls causes serious injury, such as broken bones or a head injury. More than 95% of hip fractures are caused by falling. And many people who fall, even if they're not injured, become afraid of falling. This fear may cause a person to cut down on their everyday activities. When a person is less active, they become weaker, and this increases their chances of falling. That's something that we see all too often working in this field. So what causes people to fall? We'll talk a little bit more about each of these causes, and also just know that this is not an exhaustive list. Dr. McCauley touched on some of these in his presentation on Monday as well, and that video is on the Aging at Home website. But just to go over a few more, we'll talk about these kind of from the PT perspective today. And my recommendation is that if you have concerns about any of these, please don't hesitate to bring it up with your primary care physician. So first, medications. Basically just know that there's so many medications out there that have dizziness listed as a side effect, but there's a lot of other side effects that may contribute to falls as well. Sometimes medications prescribed by different physicians may interact poorly with each other. And when you're seeing multiple specialists all prescribing different medications, they don't often see the full list together. Also, medications that you maybe have been taking for a long time start to have new side effects after prolonged use. So just because you've been using it for a while doesn't mean, oh, it couldn't be at fault or it couldn't be contributing to this. So my recommendation there is to make a list of all the medications you're taking, prescription, over the counter, and any vitamins that you take regularly. Keep that list with you for all medical appointments, but also if you have any concerns about these drug interactions or anything that might be happening with your medications, take that list to your primary care doctor or to a pharmacist, and they can review and go over it for you. So past injuries, arthritis, and other medical conditions. Any past injuries like a past bone or joint injury, a head injury, or a surgery may be contributing to increased weakness or instability in your trunk or legs. Arthritis is another big one. I've seen so many people who report falls because their knees are buckling from severe OA or instability. Again, talk to your physician if you're experiencing that kind of instability, and then also consider using an assistive device to help prevent falls. Other medical conditions that we kind of see with more obvious factors would be Parkinson's disease, multiple sclerosis, past strokes, and there's so many others that of course could contribute to imbalance. Often in Fairbanks, I've seen people with signs of these diagnoses that haven't yet been diagnosed. So make sure that if you have concerns about shuffling gait, falls, postural changes, tremors, talk to them early on when you notice them, talk to your physician about them. And then also know the signs of a stroke. It's really important to seek medical attention early on if you notice any of these signs, because if you get to the hospital within 4 hours of your stroke, it's possible you might be appropriate for getting the clot buster medication, which can really significantly reduce the functional deficits we see from the stroke. Dizziness. Dizziness happens for a wide variety of reasons. One of the more commonly known is BPPV, or positional vertigo, in which someone sees or feels the room spin each time they turn their head a certain way or rolls in bed. If you experience this kind of dizziness with movement, definitely seek a PT referral as soon as possible. We can absolutely help. You might have to ask your physician specifically about PT, but do it. We really can help. At FMH Outpatient Rehab, myself and a few others PTs have unique experience in treating dizziness and balance, and we want to be able to help you. Of course, there's other kinds of dizziness as well, like lightheadedness when you stand up, maybe from dehydration or changes in blood pressure, regulation that tend to occur with age. Dizziness may be associated, like we said, with your medications. There's also motion sickness, maybe dizziness that you notice increases when you're in busy or crowded spaces. Again, bring these up with your physician and ask about a PT referral. It might be something that we can help you with. So environmental factors, what can I do to make my home more safe? There are lots of factors in our environment that might increase our risk of falling. From increased clutter in your home to unsafe footwear to the icy sidewalks that are going to be here pretty soon in Fairbanks. I believe yesterday the presentation was about home safety as well. And I came across a really awesome home safety checklist actually on the Aging at Home website that I'd recommend you check out if you want more guidance as well. A couple of the tips that I commonly give patients for improving their home safety. First, avoid slippers and sandals that don't have back support. Make sure that they have good tread as well so that they're not slippery on tile surfaces. Have night lights in your path to the bathroom or a table lamp by your bed to avoid walking in the dark at night. Secure or remove rugs from walkways because they're major tripping hazards. Install grab bars in helpful places in the bathroom and safe, secure handrails on the stairs. Remove clutter from all walkways, especially on the stairs, and have phones in easily accessible places to call for help in the event of a fall, or even obtain one of the wearable life alert systems if you have a history of falls. That way, no matter where you are, you can call for help if you need. Vision. So wearing bifocals or trifocals often contributes to imbalance, and sometimes, of course, falls in response to that. If it's possible, you can ask your optometrist for 2 separate sets of glasses, maybe a set of readers and then a set of far distance glasses for when you're walking or driving. I know that that's not always possible, but it may be worth asking your eye doctor about. And then vision changes that haven't been checked yet, or in your visual acuity, or even diagnoses like diabetes, macular degeneration, cataracts. These all might affect your vision and balance. It's not hard to imagine seeing some of these pictures and how each of those might affect your vision, that they might increase your fall risk. Peripheral neuropathy. This is a change in the nerve function in your feet, causing pain and decreased sensation. Decreased sensation in your feet makes it difficult to feel where your feet are in space or what surface you're standing on. Naturally, this would make it more difficult to keep your balance, especially when you're walking on an uneven surface. Sometimes neuropathy occurs without a known cause, and sometimes it's associated with diagnoses like poor circulation or diabetes. Cognitive changes. Any change in your ability to think clearly may affect your fall risk for a myriad of reasons. Changes in memory that affect your ability to remember to take medications as prescribed, to keep your assistive device with you, or to apply strategies you've learned in the past from pre-existing balance problems may increase your fall risk. Changes in your ability to multitask, to problem solve, or to make safe choices also contribute to increased fall risk. If you feel like you've noticed these changes, or maybe your family has expressed concern to you that they've noticed the changes in you, please discuss them with your physician. Also, just know that there are services like speech therapy and occupational therapy that can also help with cognitive training. And then of course, PT can address your balance. It's really important to note that there's a ton of research supporting that regular cardiovascular exercise can actually improve cognition also. So keep yourself moving. Limited community access. Whether it's because of the COVID pandemic, lifestyle changes with age, or increased fear of falling over the past year, or because of a past fall, far too often I've seen people lose strength, balance, and independence with mobility because of inactivity. I know this is especially challenging over the past 1.5 years for so many people in Fairbanks, when access to community exercise groups at the Maryside Pool, the Senior Center, and other groups like Tai Chi have been canceled. Then you add on strict quarantines and the loss of motivation or depression that may come with that. And we've definitely seen a significant decline in many older people's function. Get a referral to PT if you feel like you've lost function or strength over the past year, so we can help you to regain it and learn strategies to prevent further loss. If you're experiencing a decrease in motivation, sadness, or emotional changes because of this as well, just know that you're not alone. Speak about these concerns with your physician. It's possible that they can help. And if our emotional well-being is managed, it's so much easier to manage our physical well-being as well. It's really important to find ways to maintain activity and exercise with whatever space you're given during this time. Whether it's something as simple as sit-to-stands, marching in place, or sidestepping at your kitchen counter, find a way to keep moving throughout the day. Get out those old Jane Fonda videos, or look up a YouTube video workout to follow if you're needing some other inspiration. Just keep moving. Let's go over how our bodies now for a better understanding of how each of these previous factors might contribute to an increased risk of falling. First, there are 3 primary inputs for balance, or ways that our brains receive information about whether or not we're balanced. Our vestibular system, which is our specialized balance system deep in our inner ears, our vision, and our proprioception, or the sensation in our feet and legs. Our vestibular system is made up of several parts, with the most commonly referenced being the 3 C-shaped canals, one in each plane. Fluid moves through these canals, providing our brain with information about our movement. And this is how our brain gets information about how fast and what direction am I walking, am I tilted or falling, am I moving in a car, or am I moving up and down in an elevator. We have a matching pair of these systems on each side of our heads, and if one side is providing different information to our brain than the other, this creates dizziness and imbalance. The second source of input for balance is our vision, which is really important for providing our brain with information about where we are and if we're moving well. We can see obstacles in our path, we can see if we're level with the horizon, and we can see movement. There's also a reflex between our vestibular system and our eyes that helps us to maintain steady gaze on whatever we might be looking at while our bodies move, like trying to focus on an item on the shelf at the grocery store as you walk down the aisle. Our proprioception gives our brains information about what our legs are doing or what we're standing on, or maybe even feedback about how high I'm lifting my leg to step over an obstacle or to get it to the next step on the stairs. If any of one of these 3 systems isn't working at full function, our bodies naturally compensate by relying more heavily on the others. But when we don't have sufficient function, we begin to see balance problems and dizziness. Of course, we know that in the middle of the input and output is our central nervous system, or our brain, processing all of the information that and sending messages out to the rest of our body on what we need to do to respond. This is where the problems with thinking, past head injuries, and neurologic diagnoses may affect our body's ability to respond quickly and appropriately to prevent a fall. On the other end of this process, we have eye movement, postural control, strength, and muscle function that are important for maintaining and recovering our balance as well. Any breakdown in this system also increases your risk of falling. But this doesn't mean that we have to deal with it. Again, oftentimes there are ways that your medical team, your physician, a PT, or other rehab services can help you to regain and maintain your balance and independence. So what are some things I can do to maintain my balance at home? These are a couple basic balance exercises that you could start to try at home. If you do any of these though, and you realize that you're really off balance with them, like you're losing your balance or have a near fall, please do not repeat the exercise. It's unsafe for you to continue. If you've had any falls already in the past 6 months also, I would tend to say still not to try these at home. If this is the case, speak with your physician and ask for a PT referral to work on balance so that you can get a program specifically designed to your needs. If you are practicing these at home, always do it in a safe space with something sturdy to grab for safety and supervision, especially when you try them the first time. Examples of a safe space would be backed into a clear corner with a sturdy chair in front of you for hand support, or standing facing the kitchen or bathroom sink so that you can hold on to them as needed. So the first image there shows some different feet positions that you can use to challenge your balance. Start with feet together. If this is easy and you're stable, progress to a partly staggered stance, or as we call it in PT, it's the semi-tandem stance. If this causes slight imbalance, this is likely the best place for you to practice for now. Try it on both feet. If you're stable in semi-tandem, then you can progress to tandem standing with one foot right in front of the other. If this is too difficult and you can't maintain balance with your feet in this position, back up to semi-tandem again and practice that instead. My usual recommendation is to practice this for 1 to 2 minutes on each leg daily. Next is standing on one leg. If you're able to maintain your balance in tandem, this is likely, or if you're unable to maintain your balance in tandem, single leg stance is probably going to be too difficult and not safe to do at this time. If you are able to try it, I still recommend using light hands on your stable support surface initially just for safety, and practice for about 30 to 60 seconds total, including both legs. Take breaks as needed. I would not expect that many people out there could actually hold standing on one leg for 30 seconds without hand support. That's a pretty high level task. So you just practice for about 30 seconds on each leg and then take breaks in between as needed, right? There are some basic strengthening exercises that are also very good for balance. Heel raises and standing. For this one, always keep your hands on your stable support surface for balance while you're doing this. Lift up onto your toes as high as you can, shifting most of your weight towards your big toes, then slowly lower back down to the floor. Typically, I'd recommend doing this about 10 to 15 times, but if you get tired before that, then you can stop sooner. Sit to stands are an excellent way to work on strength and balance at the same time as well. If you tend to become lightheaded or dizzy when you stand up from a chair, please move slowly and take your time. If that continues to happen, stop the exercise and speak with your physician. The picture I included is specifically on how to stand from a chair when using a walker. You should never have both hands on your walker when moving between sitting and standing positions. One or both hands should be on your chair to push to stand. And then after you're standing, you can move both hands onto the walker. If you're using a cane, you should also have both hands pushing up from the chair, then grab the cane for standing and walking balance once you're up from the chair. Don't ever push down on the cane or walker to help you get up from the chair. If you're not using an assistive device for walking, then you can do sit to stands either using hands on the chair to push to stand or without hand support at all. Each time you stand, steady your balance before returning to sit. Then when you sit, do so with control. No plopping is what we like to say. Again, if any of these exercises make you feel very off balance, dizzy, or maybe it increases pain like knee pain with arthritis doing those sit to stands, don't continue to do them. Speak with your physician and seek a PT referral for a program that's more specifically designed for you. Even if you're able to do these, but you're still worried about balance, I would recommend still asking about PT. These exercises are generic, but a PT who focuses on balance training can prescribe specific exercises that address what your body needs to improve your balance. So I wanted to talk a little bit about assistive devices as well. Lots of people come in and they've already got canes or walkers that they've been using and they're not quite set to the right height. And a lot of people just don't know how to set them correctly. So first, let's talk about what kind of cane might be best. So there's a few different kinds out there, and I tend to recommend either the straight canes or the standalone canes like the Hurricane over the wide 4-prong or quad canes as they're called for most people. I find that the quad canes are often more cumbersome and they lead to excessive reliance on them for support, which actually can lead to decreased independence and changes in your walking pattern over time. So unless a provider has specifically recommended the quad cane for you, I'd say try and start with the straight cane or the Hurricane as the better choice. Measure the cane when you buy it to ensure it's the right fit, or even better, buy an adjustable one that you can fit later. So to adjust the cane to the right height, we've got that image there. You want to make sure that the lowest point on the handle is even with your wrist, or, most of us have that little bony prominence that's pretty obvious on your wrist, and you can kind of make it level with that. So as you can see from the correct size image there, you want your elbow to have just a slight bend in it, about 30 degrees. If your elbow's bent to about 90 degrees, or you're having to lean over to reach the cane, then those are not fit quite right. And then walkers. There's also lots of walkers out there, and choosing which one might be the best for you here. So standard walkers, that first one on the left, they have no wheels and they're really not recommended very often. I'd say most people that I've ever spoken with that have tried to use them don't like them because you have to pick it up every time you take a step. The two-wheeled walker or the front-wheeled walkers are an excellent option for most people, especially inside your house. They are smaller and more lightweight, which is helpful for maneuvering smaller spaces and doorways. They fold up for storage when they're not needed or loading into a vehicle. And when you're in your home, you don't usually need the seat that's available on the rollator because you have chairs readily available to sit on already. If the back legs are catching, you can purchase little sliders that easily go on the back legs at Walmart or Walgreens or probably even Fred Meyer here in town. And also, I have people that will say that they like the rollator because they want to put their food tray on it to carry it, or they can't carry something while they're with the walker. But there's plenty of bags and things that you can attach on your walker to carry things around, or trays. There are accessories out there if you wanted to go that route. The rollator, or the 4-wheeled walker there on the right, that one's really best used for walking in the community. The 4 wheels make it easier to navigate unlevel surfaces. There's a seat to use when you need rest when you're out on longer outings. And there are brakes for added safety when you're navigating ramps, standing up or sitting down while using the walker, standing still, or even when you're sitting to rest on that seat. Often people don't realize that if you push down on both brakes, you can actually lock them into the place so the brakes will remain locked when you turn to sit and rest on the walker seat. But do not ever use the rollator, please, as a seat to scoot around on. They're not designed to have someone sitting on the seat while moving, and this is incredibly risky as you have a really high risk of falling off of that seat. If you need a wheelchair, then get a wheelchair by speaking about this concern to your healthcare provider. Rollators will also fold up for transportation in your vehicle, but they are a little bit heavier and larger than the front wheeled walkers. To adjust the height of a walker, you would use the similar measuring standard as you do with the canes. So raise the walker handles to about wrist height. And when your hands are placed on the handles, you should have about 30 degrees of bend in your elbows. So what can PT do for me? I've been talking a lot about get a PT referral. So what can we do? We can definitely help your balance get better. And some of the ways that we do that is we can help to improve that vestibular function. We can resolve dizziness. We can prescribe balance exercises specific to your needs. We can improve strength and stamina. We can improve cognition through exercise. We can teach proper walking patterns, provide education and strategies to reduce fall risks that are specific to your history, lifestyle, and home environment. We can recommend proper adaptive equipment and teach you how to use it. And then also here we have home safety evaluations through our outpatient rehab, and we do have custom wheelchair fittings when that's appropriate. And another great thing that we offer here at FMH is our balance screens, which are actually free to anybody who's 55 years and older. So the idea with the balance screen is you can come in, you're not really sure if you need PT, but you just want to kind of make sure if your balance is okay or not. You come in and we'll do a few tests with you, and we can give you some guidance on whether we think actually moving forward with a PT referral for evaluation and treatment would be appropriate. So I do have a little video here that we made about our balance screens. So let's see if it'll load here. Is it playing?
Yeah, that's really cool.
We cannot hear it.
Sorry, I'm hearing that you guys can't hear that. I'm not exactly sure why, but I can. So on the video there, it's just showing some of the screens and tests that we do for the balance screens, and just providing information about, it kind of covered some of the things that we just talked about in our presentation, things that might cause people to have an increased risk of falling. But if you want to come in for a balance screen, the main thing is the number is there to call. That's just the number to our outpatient rehab. And like I said, it's free. You don't need a referral from your physician. You can just give us a call, say, hey, I want to sign up for a free balance screen, and then we'll try and get you on the schedule. So it's pretty easy, pretty straightforward, at least to find out. If you have any questions, might as well, it's worth it, right? So that is all that I have for my presentation there. Thank you for sticking with me through that, and I'll kind of open it up for questions here now.
Yeah, I have a question. Do you work with amputees?
We do here at our clinic. Mm-hmm.
Great. It's very good to know. I figured for every general formative exercise, there's got to be alternatives for people that have a missing limb or something like that,
Yeah, that would definitely be really unique and different to obviously some of the exercises that I gave as examples here. So we definitely work with patients with amputations and would provide a specialized program for them.
That's wonderful. So did you guys just come into town, or is this new, or how come?
No, we've been here.
Really? I mean,
Yeah,
I've talked to so many people and nobody once has mentioned this or what you provide in the community.
Yeah, so this is just the outpatient rehab that's actually through the Fairbanks Memorial Hospital. So we've been
Wow,
for a while, but yeah.
that's really good that you have that available without people having to be inpatient. That's amazing.
Yeah.
Thank you. Thank
Mhm.
you for doing this. It's really
Yeah, you're
answered a
welcome.
lot of questions and help.
Louis speaking. I have a question.
Mhm.
What was that?
Louis speaking. I have a question.
Go for it.
There are a lot of people who refer to speak with your doctor. The wait time for my physician in Fairbanks is 4 months. How do we deal with that?
So you're saying the wait time to see your physician to even get a referral is 4 months?
No, I can get a referral. I can ask for an appointment,
Okay.
but the wait time to get the appointment, I can get the appointment, but it's 4 months in the future.
At
That's
our clinic?
what?
At our clinic?
Yes, Tandem Valley Clinic.
Oh, okay. So this is Fairbanks Memorial Outpatient Rehab. So as far as Tanana Valley Clinic and getting in with the physicians, I would have to say to call the clinic and ask them about that concern. I don't exactly have an answer for that. I'm sorry. But the wait time here to get into physical therapy, once you have a referral, it should not be 4 months.
It's getting the referral that's the problem.
Right. Yeah, I understand that. And I know that that's been kind of a thing across the area recently. So
That's blame COVID.
I know that makes things tough. If your physician is one that you could call and ask for a referral on the phone, you know, that could be an option depending on your physician. If you could call and say, hey, I'm having balance problems. I can't get in to see you for 4 months. Can I at least get a referral to get in to physical therapy and get started?
Well, I was in physical therapy until I couldn't do it anymore.
Oh, okay.
I was told that also that if you've got a physician you've seen fairly recently, you can call and I was given a referral for physical therapy at one point. This summer I wanted to, it was a different situation, but because my doctor left, I haven't been able to get in to see my new doctor yet, but I was told to go to First Care, and the First Care physicians can refer you to any specialist in physical therapy or another specialist. So going to First Care is the option if you can't get in to see your physician.
Yeah.
Cassie, if somebody has balance concerns, can they make an appointment with you, come in, get the evaluation, and then if you note a significant issue that they need additional PT for, can you contact the physician and say this person, you know, has been evaluated and needs more PT follow-up? Would that help someone get in?
Yeah, possibly. So one thing that with our balance screen, so if you call and you come in for the balance screen, we have a form that we fill out and it actually has a referral form on it. So that's a really good idea. If you can't get in to see your physician, then it's possible that you could come do the balance screen and we can fax that referral to your physician. And then they just have to sign it and send it back to us. And it's got the information on there for them to fax it back to us so that we could move ahead with the scheduling your actual evaluation and treatment for physical therapy.
There are a lot of physical therapists in town and a lot of good ones, but what is different are you more comprehensive in what you can offer there at rehab services?
I think oh, sorry.
No, just,
Okay.
that was a question.
I think in a lot of ways we are, because we just have we work with a more broad age range and I think broad diagnostic range than a lot of the other clinics in town. We work with people with a lot more medical complexity and our vestibular specialty. I'm not positive. There may be other clinics in town that have vestibular rehab therapists, but we do kind of offer it all in one house. And it's what we do regularly. So our therapists here are used to that population. It's not like something that we rarely see and we're not prepared for.
I have a question about one of the balance sort of exercises. When you were talking about standing on both feet or putting them side by side or putting one in front of the other and just walking like that or practicing, what is it that is happening that's getting better? What's changing to make your balance better when you do those?
Yeah, so kind of like with anything, practice helps. So while standing with your feet together or standing with one foot in front of the other isn't going to necessarily like fix your peripheral neuropathy, it can challenge all the little muscles in your legs and your body that are, when you wibble and wobble while you're standing there, every time that you're wiggling, your body's learning to correct and to fine tune your balance responses. And then there's other things that we sometimes add in where we'll have head turns or eyes closed, which I didn't include today because of just safety concerns with giving that to just everyone. But if we do add in things like that, then we're really challenging that vestibular system as well. And as we find, when we are prescribing balance exercises, we want them to be challenging, but not impossible. Just like if you're going to go try and build your endurance with walking, you're not going to walk until you just can't get home. You're going to walk to a point where you're a little bit fatigued, but you can make it home safely. Kind of the same thing with balance. We want it to be challenging, but like I said, not impossible. And as we do that, it can actually help to improve your vestibular function so that your vestibular system starts to give your brain more reliable information about balance.
What does vestibular mean?
I don't know the meaning.
What is vestibular balance? Are we talking about brain or are we talking about your brain or your physical part?
Yeah. Sorry. So the vestibular system, it's that system in your inner ear. So the diagram I showed was really kind of heavy and loaded with a lot of stuff, but it's one of those three main sources of inputs that your brain gets about our movement. So our vestibular system is really, I think it's one of the most important parts of our body. Its primary job is balance. So when we're talking about important parts of our body for balance specifically, we really want that vestibular system to be functioning as well as it can.
Okay, so for full disclosure, I did the balance thing just test with you guys a few days ago and did fine except for the walking with my eyes closed and turning my head as I walk. Mm-hmm. Or no, not turning my head as I walk. I mean, sorry, let me back up. Walking and turning my head with my eyes open because that, and apparently that did something to my inner ear as compared to physically.
Right. So that those head turns, when you're turning your head and, really even walking, the fluid in those inner ears and those canals that we kind of talked about earlier, it's moving and giving your brain information about what direction and how fast you're moving. So if I'm walking and turning my head to scan and look around to see my environment, then my vestibular system has to be providing my brain with accurate and quick information about, oh, okay, her head is turned left, but she's still walking straight forward. If we get that information mixed up, then we start to see imbalance. So I turn my head left and now my body processes, oh, whole body's got to go left. Well, that would naturally throw you off balance.
Okay.
So I have I wanted to ask a question. Do you give any medication dietary or supplementary, or I should supplement orientated advice or referrals out from where you're at because of, the importance of diet and mobility and that particular, the vestibular system as well.
Yeah, so you're absolutely right at how important diet is, and like we said earlier, managing medications, but unfortunately that is not within our scope of practice as physical therapists. So typically if we think that there's a concern with diet or there's a concern with medication, our best route is to tell you, you really need to go speak with your physician or one of your healthcare providers, that maybe the person that referred you to us, that is within their scope of practice.
Right. And I guess the one other thing I think that is super huge, and I mean, I'm actually really relieved to have found out about this through the paper just the other day and catch up a little bit and then participate today, because it's a huge area in where I deal in geriatrics and with vulnerable, or disabled, persons, is there are a lot of people out there that don't always not only get all the information they need by the right people that are overseeing that, but there comes caretaker and provider roles that really see into, I mean, almost every morsel in a way, except the soul part of that person they're caring for. And they see things that could be very helpful. What is your role in looking at caretaker of a person and the power of attorney? What would you say would be the best role or position for a caregiver, highly skilled, to be able to communicate the importance of something they see as a mandatory reporter as well, in communicating what's best for the client or person that they're caring for, to provide that advocacy somehow? Is there a way to work through that? Because I think sometimes that position gets overlooked in the dynamics of let's just do things very generally here. Let's not really get into too much detail, and it's not successful. That person keeps ending up going backwards instead of forwards.
Mm-hmm.
What would be your advice to those in that position that see the need for exactly what you're providing and communicating that effectively, and I think responsibly as well, to the right person, or that very person that still is very cognitive? How do you, how high do you esteem advocacy, especially in the case of in geriatrics?
It's huge. It's everything. When we have patients that have caregivers that are really, present in their lives and helping them with their mobility and, all the other things that go on in life, as you said, we like them to be involved. So usually if someone comes in for their evaluation, if they have a caregiver or a family member with them that really helps with those things, it depending on the situation. So if they have power of attorney, then yes, they can immediately come back. A lot of times I'll ask the patient, do you want your family member, do you want your caregiver to come back with you today? And most of the time they say yes. So I definitely love to have them involved and find out what's going on and, what they're seeing at home, because you're right. Oftentimes the person may not know it or notice, certain things that the caregiver notices about their mobility and their safety and everything at home. So we definitely like to have that involvement. And something else that I think most physical therapists really love about our job is that we get more time with people. So when I'm working with someone, most of the time we try to see people twice a week for 40 minutes at a time. And you get to know someone a lot better. And if I'm really working on improving someone's mobility for at home, and like I said, they have a caregiver that's helping them with transfers or balance with walking or even their home exercise program, I want that caregiver here at least for some sessions so that I can make sure that they know what's going on and how to best help the patient at home as well.
Perfect, thank you.
Louis has another comment.
Ready for you.
Okay. When you talk about a power of attorney, there are two kinds, which I didn't know. There is power of attorney with nothing in front of it, and then there is a durable power of attorney. The first one.
Yeah. To be honest, the power of attorney, that's kind of outside of my scope of practice. So I don't issue those or have anything to do with them other than, you know, it affects how I can communicate with people if they have a medical power of attorney.
Okay,
Then
there was a comment about power of attorney, and I thought I would clarify that because it bit me.
yeah,
Okay,
yeah,
thank you.
you're right. There's different kinds.
You mentioned that you could do evaluations of someone's home safety. Is that something that, how would someone arrange that with you?
So typically when I've done it, I've had a patient here that I'm working with, and there's some concern that I learn of while I'm working with them that they, you know, something about their home setup might be a hindrance or unsafe, and maybe they can't just fix it on their own. They need some more guidance on, you know, what would be the best way to modify their home and have some recommendations for that. So if I'm already working with a patient and I think, oh, we definitely need to do this, then I'll ask for that referral for the home safety evaluation by kind of faxing information to the physician and asking them to send it back so we can schedule it. I believe that you could also just ask your physician for a referral for a home safety evaluation through our clinic. And when we get that referral, we schedule it and set it up with you, just like we would a physical therapy evaluation.
Hi,
Thanks.
this is Joe Duprat. I'm inquiring whether you can quickly recommend exercises that would strengthen your feet. I would guess that the feet would be a first place to look or a second place to look in terms of keeping one's balance. Offhand, can you think of things that one could do to avoid just kind of certain kinds of ailments or weakness in the feet or in the ankles?
Yeah, so some of those that I put on that list, actually, the semi-tandem and the tandem standing, the single leg stance, and those heel raises, those are all going to incorporate muscles in your feet and ankles that are working to improve their strength and endurance for balance as well. And then another really common one that we would recommend is just ankle pumps, moving your feet up and down, or I'll tell people to write the ABCs with their foot so that they're getting all different directions of movement with their ankle. And that also helps with your circulation. If you have any swelling in your feet or circulation problems, ankle pumps and ABCs can really help with that as well.
Thank you.
Mm-hmm.
Are there any more questions? If not, thank you so much, Cassie. That was a great presentation. We really learned a lot.
Thank you for having me. And Barbara, I can send you this PowerPoint too if people want access to that.
That would be great. Thank you.
Thank you.
And we'll make that available to anyone who wants it.